the quadratus lumborum. There's the iliac crest. Here is the 12th rib. We go 3-2 lateral. We get the paraspinal muscles. You can clearly see the paraspinal muscles here. We know deep to the paraspinal muscles is the QL, and we palpate oblique or transverse in a way, cross fiber of the paraspinal muscles, but deep to the paraspinal muscles, we palpate toward the vertebral body, and we're up against the quadratus lumborum, deep to the paraspinal muscles. Here we have P gun right below the 12th rib. Here we have the region of the motor point about L2. This is level with L1, level with L2. And then Yao Yan is above the iliac crest. The Yao Yan that we use is above the iliac crest in the attaching fiber of the QL. Clearly the most important two zones are the upper attachments, and here I'll use a 50 millimeter, a 20 by 50. If I had a larger patient, I would use a 75. It's possible if I had a smaller patient, I might use a 40 millimeter needle. In this case, we have a 50 by 20, so we've got a needle that we're going to insert perpendicular to the table, perpendicular, directed toward the vertebral body, and we're going to be deep on the anterior side of the paraspinal muscle. So you can see here that we're in front of, anterior to the bladder channel going along those muscles, and just needling toward the table. Now, the patient always, we want them lined up like this so that we can just get a needle perpendicular. The patient's flopping one way or the other. All of these wonderful, simple angles don't hold up. Okay, and I should right here feel increased density as we push up against the fascia of the quadratus lumborum. That's about halfway on this 2-inch needle. And if we push through it, we push through it, and our patient made a little noise. So, again, a 2-inch needle, needling toward the vertebral body on the anterior side of the paraspinal muscles, past the 3-inch line, past the outer bladder meridian. And here we come up against the density right there, and we push through that fascia, and now we're in the QL right here, and it's denser, it's more squeaky, and often one of these two needles will initiate a fasciculation. Both of those needles now are almost fully inserted, so we're 1.75 inches deep. We're in front of the paraspinal muscles into the quadratus lumborum. This is the triad: the quadratus lumborum, the gluteus medius, and the sacroiliac joint. Learn to love the triad: the quadratus lumborum, the gluteus medius, the sacroiliac joint.